Can I ask you to clarify on that point? If there's a national insurance scheme, would that allow for any provider, public or private, to be funded, or what's your opinion on that particular issue?
Well, I think that we would be privately funded, I would think. Yes, the whole issue. This would actually create efficiency in the service and also get rid of the dead woods, and the truth of the matter is the NHS is overstaffed. We could get rid of 25% of the people and it wouldn't make any difference to the service. Thank you.
Okay. That's a strong comment. I want to turn to the audience now for some response.
You placed a strong emphasis on the cleanliness of local hospitals, and I would argue that a lot of the lack of focus on the quality of care beyond clinical care in hospitals today is because of a demoralised and underpaid outsourced peripheral workforce beyond the doctors and the nurses who are employed by the NHS, such as the cleaners.
To respond to that?
Yes. You said that demoralisation is taking place because of the outsourcing of services. That's what I understand what you said. Could it not be said that it's the whole attitude throughout the whole of the National Health Service that's doing that itself? I don't think it's the just sourcing out. I think probably more of it should be sourced out, and we might get some more efficiency into the service.
Can you tell me how that's... expand on that a little bit. The outsourcing will lead to efficiency.
Well, the thing is this. When you outsource things, the people concerned in the outsourcing are there to do a job and to make it pay.
Of course.
That's it. So therefore, they will work harder.
By cutting wages?
I don't know about cutting wages. I never mentioned anything about that.
I want to bring Lillian to this as well.
I don't think that's necessary, to be honest. But we've heard all of what Labour has said and what the Lib Dems have said. We've heard it all before, and nothing changes.
So, a strong desire for significant change. I want to hear from your work in the unions, what you view on that, and particularly getting back to this issue of outsourcing, whether or not it brings efficiencies.
I thought the questioner had it absolutely right, which is that the way in which, if you outsource services like cleaning, like portering services, those sort of things which would be traditionally seen as vulnerable, what happens is a private company comes in. What have they got to do? They've got to make profit. So they've worked out how much they've made a contract for, and then they will look at making their costs cheaper. And the obvious way to try and do that is to use less staff, to not to spend any money on training those staff, not to spend any money on decent development for those staff, to stop paying them sick pay when they're off sick, so people come in when they're not very well. And of course, you'll end up with a workforce who are completely demoralised. You get high staff turnover, people who don't properly know how to do their jobs. Now, in my experience, the people who work for the health service are committed to the work that they're doing. They work extremely hard. They do an extremely good job. But there will always be places where we can make improvements and do things better. And I think the way to do that is to talk to the staff who work in the health service about how they think things could be improved. But of course, as Tony said, and he's quite right, is that it's patients who to some extent should be driving this agenda, and we have to find ways of working together of patient groups and local people about the sorts of services they want, and talking to the health service about how we can provide the services that people need.
Thank you. I want to bring a couple more opinions in from the audience. There was one at the back there here.
Yeah, this is the UKIP candidate. There's about 400 medical students who are all looking to work in the UK after they graduate. Are you saying that about 100 of us should just drop out now to improve the efficiency of the NHS?
Okay, and we'll take the next question before we get some answers together. There's another one. Yeah, up here. Oh, go for it. Okay, just a very brief response to that. Do you want 100 of us to leave?
Well, the point is this, that like what Labour has just told you, we've heard it all before, and I suppose we'll all hear it again sometime. The fact is, nothing changes. And the very fact that I didn't suggest anybody should be made redundant or shouldn't get a job. As a matter of fact, I think with the extra efficiency, we would get less complacency in the whole NHS, and that's what they suffer from. Complacency.
Thank you very much.
Two quick points, if I may. outsourced work tends to be creaming off the easy operations, the easy procedures, and leaving the more complicated things back to the NHS. So of course outsourcing, when it concentrates on one particular activity and doesn't have anything else to worry about, can appear to do it cheaper, but I don't think it actually does. The second point is, in terms of efficiencies, I know, because I have a consultant friend who works in the hospital in the Wirral, that the NHS has made enormous savings over the last few years. It's still making enormous savings, and despite rumours to the contrary, making productivity gains as well, because they are achieving more operations, more successful operations, with less money. So I don't think that some of the UKIP points are really valid.
Thank you. I think we've exposed certainly a spectrum of opinion across.
In 1952, explaining why he thought it would be a mistake to charge those born overseas for NHS services, Nye Bevan wrote, "If the sheep are to be separated from the goats, both must be classified. What began as an attempt to keep the health service for ourselves would end up being a nuisance to everybody. Happily, this is one of those occasions when generosity and convenience march together. The government introduced charging regulations in the NHS, in NHS secondary care in 2004, affecting refused asylum seekers and other vulnerable migrant groups. Putting aside public health concerns and basic decency, do you not think it would have been sensible to attempt, before introducing these regulations, to assess whether these people were a significant burden upon the NHS, as the Daily Mail claims, or whether Nye Bevan's point was still valid? Do members of the panel feel that, given the harm they're causing, these regulations should be suspended until this evidence is available?
Thank you very much.
I think it's a really interesting point there that includes both reference to policy and also to the policy process and about the role of evidence. I'm going to, again, I'm afraid, go straight to Lillian and ask her to represent, as the Labour government introduced these regulations, I know that there's diversity within the party on that, what your view is. I know you can't necessarily speak for the whole party, but your personal view.
I have to admit, I don't know a great deal. I mean, obviously, I know what you've just put in your question, Tom. I mean, I think there's two parts to it. One is around how people feel about their NHS. People who pay, who've come to this, who pay taxes in this country, is people very clearly feel that everyone should pay into the NHS because that's what enables everyone to take out when they need it. And that's clearly very important. And so I understand the pressure that exists to seem to be fair to the people who pay into the service. And we know that, unfortunately, in recent times, the issue of immigration and migration is very high up the political agenda. And I think that puts an immense pressure on politicians to actually to address those issues around fairness for people who are paying the taxation that pays for our NHS and who is accessing the services. So I do understand the pressures which have led to changes in the sort of changes that you describe. Having said that, my personal view is that, of course, from a humanitarian point of view, is that if people are in need of treatment who are here, then it is the right thing to do for them to have access to medical services. And, people who are, as you described, failed asylum seekers, very likely to have come to this country with absolutely nothing. They're not going to have funds to be able to pay for those services, and it's quite right that they should have access to them. And I'm more than happy to find out more information about your campaign and to see how I can work with you to try to change party policy if we've got it wrong. The other thing I wanted to say, which is about the importance of working with migrant communities really effectively, because I know from talking to people in the health service that I've spoken to, that very often people who come to this country who don't speak English as a first language, who don't understand necessarily how our health services work, only come in contact with health services when they reach a crisis point or when there's a chronic problem. And it's really important that we work with everybody who's in this country, wherever they're, whether they're, in people who've lived here for ages or whether they're people who've just recently come, to ensure that they have access to preventative health care and to health education to ensure that we deal with things quickly. And I know